80% of mothers intend to breastfeed, but only about 20% are exclusively breastfeeding at 6 months. According to a 2010 study, it is estimated that if 90% of U.S. families breastfed exclusively for 6 months, we could prevent 911 deaths and save $13 billion per year in pediatric outcomes alone. Women who do not breastfeed or wean early are at greater risk for postpartum depression, osteoporosis, type 2 diabetes, and breast, uterine, and ovarian cancers. Reducing these cancer rates can be directly correlated to the cumulative duration of breastfeeding over the mother's lifetime. For ovarian cancer alone, this risk has been shown in some studies to be reduced by about 2% for each month of breastfeeding. So why aren't we breastfeeding our babies at greater rates? According to the American Academy of Pediatrics, SIDS rates may be higher in formula-fed infants when compared to those that are exclusively breastfed. Formula feeding is expensive, inconvenient, and not as environmentally friendly as breast milk. Most formula is not sterile, unlike breast milk. Formula usually needs to be heated to appropriate temperature, unlike breast milk, which is always the perfect temperature. Formula is created by man in a lab to include basic nutrition categories for survival. But breast milk is already the perfect nutrition in the exact amounts for baby and changes as baby's needs change. Formula feeding increases the incidence of cavities, ear infections, and respiratory infections. Formula feeding increases the risks of many diseases and conditions for baby, such as diabetes, eczema, allergies, cancer, obesity, and heart disease. Breast milk is brain food and encourages sensory and cognitive development. Babies fed formula have been shown in some studies to have lower IQs than their breastfed counterparts. The brain of a newborn develops rapidly. The most ideal fuel for this rapid growth and development is breast milk. The act of nursing a newborn causes the release of oxytocin, which causes the uterus to contract and shrink to pre-pregnancy size. Natural, baby-led breastfeeding burns 300 to 500 calories per day. So again, why are we not breastfeeding our babies in higher numbers? Why are we risking higher rates of diseases in our babies and in ourselves?